Hello friends, I'm Dr. John. Today I'm going to talk about that mysterious enemy that can turn your life into hell, force you to quit your job, and even compel you to lock yourself in a dark, silent room. Migraine. Now let me ask you a question. Have you ever experienced a moment when your head felt like it was being hammered, light flashes passed before your eyes, and your stomach turned upside down? If you have, congratulations. You're in that lucky 12% group of the world's population. I'm joking, of course, you're not lucky at all. But you're not alone either. Billions of people struggle with this cursed disease every year. Now let's get to the scary part. Globally, 1 in 5 women and 1 in 16 men are migraine patients. And in Turkey, nearly 1 in 5 people suffers from migraine. So right now, one of you dear viewers watching this video definitely suffers from migraine. Or at least someone in your family circle, in your friend circle, must be enduring this pain. So why is the treatment of this widespread disease so difficult? Why has humanity been dealing with this headache for thousands of years? And most importantly, why do some people get migraines while others don't? In today's video, you'll find answers to all these questions. But we won't stop there. I'll tell you everything from natural migraine treatment methods to the most effective medications, from avoidance strategies for triggers to everything else. If you're ready, let's begin. But first, a small warning. This video will last 20 to 25 minutes, because migraine isn't a simple topic that can be explained in 2 minutes. So grab yourself some tea or coffee, sit in a comfortable place, and watch until the end. Believe me, you won't regret it. Section 1. What is migraine? 1:30 to 4 o'clock. Let's start with the most basic question. What exactly is migraine? Migraine is a neurological disorder where your brain's nerve cell alarm system goes haywire. It's not a simple headache. Absolutely not. Migraine is a severe, throbbing, pulsating pain usually felt on one side of your head. And this pain doesn't come alone. It brings a bunch of lovely friends with it. Nausea, vomiting, light sensitivity, sound sensitivity, and even sensitivity to certain smells. Now, reading this far, you might say, well, it's just a headache. What's the big deal? But no, friends, no. Migraine is not an ordinary headache. Let me give you an example. With a normal tension-type headache, you feel like a tight band has been placed over your head. You're tense, your muscles are tight, but life goes on. But when migraine comes, your life literally stops. You can't go to work, can't go to school, your social life collapses. And here's the interesting part. Migraine attacks can typically last 4 to 72 hours. That means you can lie like you're dead for a full 3 days. 3 days. A quarter of the month. Almost half the week. Now let's go back a bit and look at the history of migraine. Because migraine isn't a new disease. On the contrary, it's as old as human history. In 3000 BC, yes friends, exactly 5,000 years ago, Sumerian epic poems mention pains consistent with migraine. Trepanation marks have been found on skulls from prehistoric times, meaning skulls were drilled for treatment. Can you imagine? My head hurts. Should we drill my head to let it breathe? Fortunately, modern medicine has advanced a bit, thank goodness. Hippocrates, the father of modern medicine, mentioned migraine aura, the warning signs before the pain, in 400 BC. Then in 200 AD, a physician named Aretius made the first complete definition of migraine. Its occurrence in attacks, clinical features, physical and mental symptoms. The word hemicrania, half-head pain, evolved into the word migraine over time. And today, we all shudder when we hear this word because we know very well what it means. In 1865, Edward Living wrote the first monograph on migraine. Then in the 20th century, scientists began researching chemical substances in the brain. Serotonin, trigeminal nerve, CGRP, calcitonin gene-related peptide. But unfortunately, despite thousands of years passing, we still haven't found a definitive cure for migraine. We've only learned to manage it. Now, what if I told you that migraine is a disease that strikes not only ordinary people, but also the greatest geniuses in history? Yes, you heard right. Charles Darwin, the father of evolutionary theory, was a chronic migraine patient. Friedrich Nietzsche, the philosopher, spent most of his life with migraine pains. Sigmund Freud, Vincent van Gogh, Pablo Picasso, they all had migraines. In fact, some art historians say that the distorted shapes in Picasso's paintings of women's faces actually stem from the visual disturbances he saw during his migraine attacks. So the migraine was so severe that it even affected his art. But at least magnificent paintings resulted, right? Ah, dark humor. Lewis Carroll, author of Alice in Wonderland, also had migraines. Elvis Presley, Virginia Woolf, Stephen King. The list goes on and on. So is migraine a genius disease? Of course not. But it shows that this disease doesn't care who it strikes. Whether you're kings, philosophers, or rock stars, when migraine comes, everyone's equal. Now let's get to the scientific part. What exactly is happening in your brain that causes you to suffer so much? Your brain is an incredibly complex organ. Billions of nerve cells, trillions of connections. These nerve cells constantly send electrical signals. Normally, these signals are orderly, harmonious. But in some situations, this order breaks down. The trigeminal nerve in the brainstem, the brain's largest pain transmission pathway, gets triggered. Then the blood vessels in the brain dilate, constrict, dilate again. During this time, levels of chemical substances like serotonin drop, and a neurotransmitter called CGRP is released. This substance is one of the main culprits in migraine. During this chemical chaos, the brain says, "Wait a minute, something's wrong here," and activates the alarm system. And that alarm is the migraine attack. In some people, this alarm system is very sensitive. Just like some fire alarms go off even while cooking, some people's brain alarm systems go off at the slightest irregularity. That's what it means to be a migraine patient, a supersensitive brain alarm system. And migraine isn't just a headache. Sometimes there are warning signs called aura. Light flashes pass before your eyes. You see zigzag lines. You feel tingling in your arm. You have difficulty speaking. This aura period lasts 5 to 60 minutes. Then the actual headache begins. Now let's get to the symptoms of migraine. But first, let me say, as I count these symptoms, I'll go from 7 to 1. From the most common to the most important. Symptoms 7. Fatigue and exhaustion. Before or after a migraine attack, you may feel incredible fatigue. You feel like you've been hit by a truck. These are called prodrome or postdrome periods. Sometimes just this fatigue comes without an attack. Symptom 6. Visual disturbances, aura. Light flashes pass before your eyes, zigzag lines, blind spots appear. Some patients say they can't see with one eye. This period usually lasts 20 to 60 minutes, and then the actual headache begins. Aura is seen in only 30% of migraine patients. Symptom 5. Nausea and vomiting. During a migraine attack, your stomach turns upside down. Such nausea comes that sometimes you even vomit bile. And the bad part, vomiting doesn't relieve you. In normal headaches, vomiting can provide relief, but in migraine? No sir, it's not that easy. Symptom 4. Light and sound sensitivity. During a migraine attack, the slightest light, the faintest sound becomes unbearable. Sunlight hurts your eyes. A person's speech scratches your ears. That's why migraine patients retreat to a dark and silent room. Light and sound literally turn into torture. Symptom 3. Throbbing headache. Here's the main symptom of migraine. But this isn't a normal headache. A pulsating, throbbing pain, like a hammer hitting inside your head, usually one-sided pain. Like your head is about to explode. And this pain can last 4 to 72 hours. 3 days. You can endure this pain for a full 3 days. Symptom 2. Movement worsening the pain. During a migraine attack, moving makes the pain even worse. Walking, climbing stairs, sometimes even just turning your head increases the pain. That's why migraine patients try to lie still during attacks. Symptom 1. Smell sensitivity. And our most important symptom, smell sensitivity. Perfume, cigarette smoke, food smells. Even smells you normally like become unbearable during a migraine attack and increase the pain even more. Some patients say, "I smelled something. I know pain is coming." Now let's get to the most important section. What triggers migraine? Because if you know the triggers, you can prevent attacks. Trigger 1. Stress. Stress is migraine's biggest enemy. Work stress, school stress, family stress. All kinds of stress can trigger migraine. In fact, sometimes even the end of stress is a trigger. You relax on the weekend and bam, migraine comes. This is called weekend migraine. Trigger 2. Sleep pattern disruption. Too little sleep triggers it. Too much sleep too. Your brain loves routine. Irregular sleep hours are an open invitation for migraine. Trigger 3. Hunger. Skipping meals, dropping blood sugar. These are also migraine triggers. That's why migraine patients should eat regularly. Trigger 4. Certain foods. Chocolate, cheese, red wine, processed meats, caffeine, artificial sweeteners, especially MSG. These foods trigger migraine in some people. But attention, the same foods don't trigger in every person. You should track which foods trigger you and avoid them. Trigger 5. Hormonal changes. Especially in women, hormonal changes like menstrual periods, pregnancy, menopause trigger migraine. Migraine is 3 times more common in women than men. Hormones are the reason. Trigger 6. Environmental factors. Bright lights, noise, strong smells, weather changes. These can also be triggers. In fact, some migraine patients sense it before a storm comes. They're natural barometers. Now let's get to treatment. First, let's talk about medications, then we'll move on to natural methods. Simple painkillers *. For mild migraine attacks, ibuprofen, naproxen, or acetaminophen, Tylenol, can be used. But attention, if you take more than 15 tablets per month, medication overuse headache can occur. Meaning, the more medication you use, the more headaches you get. Triptans *. Here are the special migraine medications. Sumatriptan, rizatriptan, zolmitriptan. These drugs block CGRP in the brain and constrict blood vessels. Very effective if taken in the first 1 to 2 hours of a migraine attack. But they have side effects: nausea, dizziness, muscle weakness. In heart patients, those with high blood pressure should absolutely not use them, because they constrict blood vessels, can create heart attack risk. In Turkey, triptans are prescribed by neurology specialists, and a maximum of 6 to 9 doses per month can be written. They're very expensive medications. New generation drugs *. In recent years, new drugs called CGRP antagonists have emerged: abrojpant, rinjpant. These have fewer side effects than triptans, but are more expensive. There are also monoclonal antibodies we call migraine vaccine, or migraine injection. These are given once a month and can reduce attack frequency by 50 to 60% in chronic migraine patients. A truly groundbreaking treatment. Preventive medications *. If you experience 4 or more attacks per month, preventive medication therapy should be considered. Beta blockers, propranolol, antidepressants, amitriptyline, antiepileptic drugs, topiramate, valproate. These drugs are used daily and reduce attack frequency. Now let's get to the most important section: natural treatment methods. Because medications are expensive, have side effects, and don't always work. But natural methods? They're both cheap and safe. 1. Acupuncture *. The most effective natural method in migraine treatment is acupuncture. Clinical studies have shown that regular acupuncture sessions significantly reduce the frequency and severity of migraine attacks. Just make sure to go to an expert acupuncture specialist. 2. Ginger *. Ginger is a miraculous plant. It has anti-inflammatory properties, meaning it reduces inflammation. And most importantly, it also relieves nausea. Ginger tea, fresh ginger. You can consume it however you like. If you drink ginger tea immediately at the start of a migraine attack, it can reduce the severity of the pain. 3. Rosemary *. Rosemary is very good for headaches due to its anti-inflammatory effect. You can drink rosemary tea or massage your temples with rosemary oil. 4. Chamomile *. Chamomile is an antioxidant plant. If you consume 2 cups of chamomile tea daily, it helps prevent migraine attacks. You can also massage with chamomile oil. 5. Lavender oil *. Lavender oil has a relaxing effect. During a migraine attack, apply lavender oil to your temples and neck and breathe deeply to inhale its scent. You'll relax. 6. Peppermint oil *. Peppermint oil prevents sinus pressure and reduces pain. It has a cooling effect. You can apply peppermint oil to your temples or drop it in hot water and inhale its steam. 7. Magnesium supplement *. Research has shown that migraine patients have magnesium deficiency. Consume magnesium-rich foods, legumes, spinach, walnuts, hazelnuts, black-eyed peas. Or take magnesium supplements. 400 to 500 milligrams of magnesium daily can reduce migraine frequency. 8. B2 vitamin, riboflavin ***. Attack frequency decreased by 50% in migraine patients taking 400 milligrams of B2 vitamin daily. Isn't it miraculous? 9. Yoga and meditation ***. Migraine doesn't directly affect blood values. However, magnesium deficiency, B12 vitamin deficiency, and D vitamin deficiency are frequently seen in migraine patients. So you should have blood tests done and check these values. Also, brain imaging, MRI, CT, is not necessary for migraine diagnosis. Migraine is a clinical diagnosis, meaning the doctor asks you questions, listens to your symptoms, and makes the diagnosis. However, if you have atypical symptoms, sudden onset, very severe pain, neurological losses, migraine starting for the first time after age 50, then imaging may be necessary. For chronic migraine diagnosis, there should be headaches 15 days or more per month, and at least 8 of these should have migraine characteristics. If you've been diagnosed with chronic migraine, preventive treatment must absolutely be started. Stress is the biggest trigger of migraine. Yoga and meditation reduce stress, relax muscles. Do yoga 3 times a week for 30 minutes. You'll see its incredible benefit. 10. Cold compress ***. During a migraine attack, put a cold compress on your temples and neck. Cold constricts blood vessels and reduces pain. Apply for 15 to 20 minutes. 11. Regular exercise ***. 30 minutes of brisk walking, swimming, or cycling 3 to 4 times a week. But attention, very intense exercise can trigger migraine. Exercise at a moderate pace. 12. Sleep routine ***. Go to bed at the same time every day, wake up at the same time. Sleep routine is golden for migraine patients. 13. Drinking water ***. Dehydration is a migraine trigger. Drink at least 2 to 2.5 liters of water daily. Especially when you wake up in the morning, immediately drink 1 to 2 glasses of water. 14. Keeping a food diary ***. Note which foods trigger migraine. Then avoid those foods. Everyone's triggers are different. Section 9. Do's and Don'ts in Migraine. 24:00-26:00. Things to do ***. Take medication immediately at the first sign of a migraine attack. Retreat to a dark and silent room. Try to sleep. Apply cold compress. Drink plenty of water. Take deep breaths. Things not to do ***. Don't overuse medication. Don't use more than 15 painkillers per month. Don't consume excessive caffeine. Don't stay hungry. Don't sleep irregularly. Don't enter bright lights or noisy environments. Don't consume alcohol, especially red wine. Don't smoke. Don't overdo screen time, phone, computer. So friends, that's everything you need to know about migraine. Let's summarize. Migraine is as old as human history, a neurological disease affecting millions of people. Treatment is difficult, but not impossible. Medications, natural methods, lifestyle changes. If all are used together, migraine can be controlled. The most important thing is knowing your triggers and avoiding them. Keep a migraine diary. Note in which situations attacks occur. Sleep regularly, eat regularly, avoid stress, exercise, drink plenty of water. And remember, don't let migraine defeat you. Yes, it's a difficult disease. Yes, it's painful, but it's a manageable disease. With the right approach, in cooperation with your doctor, you can learn to live with migraine and lead a quality life. If this video was helpful to you, please like, share, and don't forget to subscribe to my channel. Because I'm Dr. John, and I present you with scientific, reliable health information every week. And one last note, if you have migraine complaints, please consult a neurology specialist. Internet videos absolutely don't replace a doctor. I'm giving you information, but diagnosis and treatment must absolutely be under a doctor's supervision. Stay healthy, friends. See you.